you have an anterior cruciate ligament injury, you have a sensation of losing balance when you walk, run, jump, climb the stairs. This kind of sensation will lead to an instability and you would not be confident on your knee. Hi, I am Dr. Virendra Mudnu, consulting orthopedic surgeon at Apollo Spectra Hospitals, Kondapur, Hyderabad. I am specialized in arthroscopy and joint replacement procedures of the hip, knee and the shoulder. In this video, I'd be talking on knee arthroscopy and treatment of anterior cruciate ligament injuries. ACL is a ligament which is inside the knee joint. If you look at the knee is a hinge joint. Knee is made up of four important bones: the thigh bone, the shin bone, the fibula and the kneecap or the patella. These four important bones form the knee joint. If you look at a normal door hinge and compare it to the knee, there is no interlocking between the two structures. The stability of the hinge is largely dependent on four important ligaments. Two of them are inside the knee joint. They are called as anterior cruciate and posterior cruciate. These two ligaments cross each other inside the knee joint. That is the reason they are called as cruciate ligaments. The two other ligaments on either side of the knee are called as collateral ligaments, the medial collateral ligament and the lateral collateral ligament. So the stability of the hinge is largely dependent on these four ligaments. So one of the most common ligament injury which will happen in the knee is the anterior cruciate ligament. Anterior cruciate ligament injury is usually secondary to a sports injury. It could be a trivial accident or a road traffic accident, or could be a simple trip and fall at the home from a stair or something. If you have an anterior cruciate ligament injury, you have a sensation of losing balance when you walk, run, jump, climb the stairs. This kind of sensation will lead to an instability and you would not be confident on your knee. This is secondary to an anterior cruciate ligament injury. After an ACL reconstruction, the rehabilitation is a very important part of the treatment. Once your ligament is reconstructed, we have put a graft from another part of your body, which is usually your hamstrings graft, your quadriceps graft or your peroneus graft. The recovery process after an ACL reconstruction is very important part of the treatment. Immediately after the surgery, we will be putting in a long knee immobilizer and you'll be made to walk with weight bearing as tolerated with the help of a walker. You are attached to a physiotherapist who would teach you to do isometric quadriceps exercises, ankle and toe movements, walking with the walker with or without putting weight on the leg depending on the patient's condition, individualized according to his treatment. Most of the patients who have isolated ACL ligament injury are recommended to bear weight as they are able to with the help of a walker. You are advised to do passive movement in the knee joint from 0 to 90 degrees from day 1. Quadriceps exercises are advised. Your range of motion is increased weekly from 0 to 30 degrees. In the second week to 0 to 60 degrees, in the third week 0 to 90 degrees. Once you are able to walk comfortably, you are shifted to a hinge knee brace so that you can be mobile outside the house and you can go to your office as well. After 4 to 6 weeks of the physio, once you regain the complete movement, you are advised strength training with the help of a physiotherapist, or you can attend a gym and strengthen your quadriceps muscles, your hamstrings muscles, calf muscles, so that you have a proper strength in your knee and a proprioception training as well is given to you. Return to sport after an anterior cruciate ligament injury is a very important part. Most of the patients should understand that they will have to give a dedicated time of rehabilitation at least for about 3 to 6 months. An average time of returning to sport is about 6 months to 9 months depending on the sport you play and depending on the rehabilitation you are indulging in. The risks in an arthroscopic surgery of the ACL are very minimal. When you compare to any other open surgery, the risk of complication in arthroscopic procedures of the knee are very minimal to about less than 1%. The common risks are you would have pain and swelling immediately after the surgery, a little bit of numbness on the anterior aspect of the knee. In some conditions, very rarely, less than 0.1% of the patients might develop an infection which would manifest as increased temperature, increased swelling around the knee and painful movement. You would be advised a couple of blood tests to make sure that there is no evidence of infection. If you are having an ACL injury or if you are suffering from a complication of ACL surgery, you can visit to us at Apollo Spectra Hospitals, Kondapur, Hyderabad.